My dear colleagues, Assalamu alaikum and a very good morning to one and all. My name is Abdul Hakam Usman, second year student of PharmD Post Bachelor. I stand here before you on this beautiful hour of the day for an oral presentation on a topic titled Collaborative Strategies to Combat Antimicrobial Resistance. So without much ado, moving right ahead to the main topic of discussion proper. When we are really talking about preventing antimicrobial resistance together, let me precisely ask this question. When was the last time any one of you here have an infection? It probably wasn't a great worry because you know that you can easily get some antimicrobial agent from any of the medical store that we have at the side of the road. Yes, you can easily get the antimicrobial agent for your infection. But the problem is, these antimicrobial agents do not kill microorganisms as well as they used to. Microorganisms have become resistant. In fact, there are some microorganisms which are now totally and completely resistant to all non-antimicrobial agents, such as methicillin resistance, Staphylococcus aureus, vancomycin resistance, enterococcus, multi-drug resistance, mycobacterium tuberculosis, and many more. So what is this antimicrobial resistance and why do we need to take action against it? Antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites stop responding to medicines, leading to longer hospital stays, higher medical costs, and the increased mortality as defined by WHO. So this is just few of the consequences that is caused by antimicrobial resistance, and that is why antimicrobial resistance have become a global concern, and it's one of the biggest threats to everyone on earth. And this problem is only going to get worse unless we act fast and together. We are going to enter an era where no antimicrobial works. It will be like going back to the 1930s before they were even discovered. Infections at that period of time were very fatal. Complex surgeries are impossible because of the risk of infections. And today, modern medicine depends massively on antimicrobials, particularly antibiotics. So what do you think will happen when we lose this antimicrobial agent? Because of the catastrophic effect of antimicrobial resistance, we are going to lose so many things. The first thing we are going to lose is any protection for immunocompromised patients. There are some patients that have weak immune system, such as cancer patient, HIV patient, transplant recipient, premature babies, and many more. Study shows that this type of patients have weak immune system. Therefore, they need antimicrobial agents, particularly antibiotics, for their survival. Secondly, we are going to lose any treatment that install foreign object in the body, such as dialysis, joint replacement, and many more. How many people today need knee replacement or joint replacement, hip replacement? Study shows that 1 out every 6 of these people are going to die if there is no antimicrobial agent. Thirdly, we are going to lose surgery. Nowadays, many operation theaters are preceded by prophylactic doses of antibiotics. Without that protection, doctors are going to lose the ability to open the hidden spaces of the body. So imagine where there is no abdominal surgery, no bowel treatment, no cancer treatment, no cesarean section for pregnant women who are unable to give birth on their own. When it is only choice for the doctors to open the womb of the mother and take out the baby. How many people are going to die? Definitely the number will increase from 1.27 million deaths annually to 10 million deaths by 2050 if care is not taken. Therefore, we need to take action. Although we know that antimicrobial resistance is an inevitable biological process, but we bear responsibility. How we did that? We did that by squandering antimicrobial agents with a heedlessness that now seems very shocking. However, practicing safe use of antimicrobial agent by adhering to few following simple steps that I will discuss with us here, we can all become antimicrobial guardian. Step number 1, do not demand any antimicrobial agent from your doctor. Do not demand any antimicrobial agent from your doctor. Before that, I would like to discuss some of the factors that influence the development and spread of antimicrobial agents. The first factor is prescribing antimicrobial unnecessarily. It is quite disheartening today. Many doctors involved in carelessly accelerating the antimicrobial resistance. In most of the hospitals, 50% of antimicrobial agents, particularly antibiotics, Particularly antibiotics, they are prescribed unnecessarily and for no documented reasons. Most of the prescriptions are for conditions that antimicrobial agents cannot help, such as flu, sore throat, coughs, and many more. And most of the prescriptions sometimes are written without considering important criteria for correct doses. Therefore, doctors should work and coordinate collaboratively with pharmacists before making any prescription medications, and therefore they should only make prescription when only necessary needed by the patient. Secondly, medical laboratories today are also accelerating antimicrobial resistance. Without accurate diagnosis of culture and sensitivity tests, doctors are going to prescribe incorrect medications for their patients. Today also, antimicrobial agents are misused in humans and agriculture. Many farmers are using these antimicrobial agents, particularly antibiotics, in order to hasten the growth of their livestock, only to get more profit in the market. We are all doing this for ourselves. And the ones we encourage and separate this resistance into existence, we don't know where this problem is going to stay. So with practicing safe use of antimicrobial agents, by adhering to few following simple steps, we can all become antimicrobial guardian. Step number 1, do not demand any antimicrobial agent from your doctor. We have all been there, begging doctors for antimicrobial agent when we are sick. We don't need antimicrobial agent anytime we are sick. Some conditions or some antimicrobial agents cannot help some conditions like sore throat, as I have mentioned earlier. So you should talk to your pharmacist for OTC medications when you are sick. Secondly, take full treatment of antimicrobial exactly as they are prescribed to you. Do not store antimicrobial agent for future use, and do not give them to anyone, even in your family. They can work better if they are used appropriately. Step number 3, patients should give correct information of the